whether other people find this, but towards the end of the day, it's almost like I'm absorbing so much stuff that it's kind of quite hard to take in the last hour of the day or so. And I wonder whether you'd be happy teaching us maybe that neck manipulation we can try on each other, just to kind of break the day up a bit if we have time.
Yeah, I'll be happy to do that.
Thank you.
Keep reminding me. Okay, so what I'd like to do is I'd like to do about 20 minutes of fairly quick going through all of this, and then we have Margaret at 10 o'clock. Okay? And yours is actually at 11. That's what it's written on.
Then that's what it is.
So place both feet on the floor. Close your eyes. And breathe out 3 times. See a clock in front of you. There is something wrong with a clock. Now this is an image. You can do whatever you want. You can extract any tool you want. Figure out what's wrong with the clock and mobilize whatever you need. You can beam it through Star Trek for all I care. Whatever tools you need, and fix the clock. Until the clock is fine, doing what it's supposed to do. Take a deep breath and open your eyes. Anybody wants to share what happened? Yes?
My clock was a grandfather clock, and the pendulum wasn't swinging, so the clock wasn't working. So all I had to do was, I stepped in and I just used my hands to start it going, and adjusted the hands of the clock. And everything
Adjusted the hands.
Yeah, so I had to,
So
because the time was incorrect.
Oh, the time was incorrect.
Yeah, so because the pendulum wasn't moving, so I had not only had to start it going again, but then set it to the correct time so that it would continue at the correct time. Yeah.
One more person?
Mine just had a bit of WD-40 on it. It was a bit rusty.
Okay.
And it was dirty, and it just cleaned it up. So
But what was wrong with it? What was it doing? What was it not?
The parts were seized.
The what?
The components were seized, so it's used a bit of lubrication oil. So.
I did the opposite. I boiled mine in hot water.
You boiled yours in hot water?
Brilliant, I didn't know that.
You're looking as though you're not really expecting these results.
I'll tell
Shocked
you.
by the English cycle.
Well, no, I would just never think of putting a clock in hot boiling water. That's a...
One of the mechanisms.
Sorry?
One of the mechanisms.
Only,
And
okay,
also
yeah.
clock.
It's just something it would never occur to
They
me.
get gunged up. Over years they get gunged up.
Yours actually, his makes a lot more sense than you might think. Okay, so here's the dogma. Okay, it doesn't work 100% all the time. Because you asked me if I do other things. So yes, the answer is yes. Here's whatever is wrong with the clock is wrong. Is what's wrong with your life. Okay. Now it's your subconscious talking. Oh, now you're all going, oh shit. Whatever is wrong with the clock is in all likelihood what's wrong with your life. Don't take it too literally at 100%. It doesn't work 100%, but it works about 75–80% of the time. Okay. Whatever you did to fix the clock is what you need to do to fix your life. Wait.
I had a bath this morning.
Wait a second, hold on. These are metaphors, okay? So the thing why I believe it makes sense for Tim is because Tim is constantly talking about cleaning up his diet, detox, This is something, it's a project that he's been looking at for a long time and implements and slides away. So yeah, it makes sense, so do you see how for me the image, I would never think of putting a clock component in boiling water because I'd be afraid it will, but for him, the metaphor makes sense for him. I don't know anything about you, so it's hard to say, but the metaphor suggests that you needing a little momentum, you need a little push in your life,
Yeah.
you know, and that's what it suggests. So therefore, because I'm assuming, okay, don't take this too seriously, because it's like, you know, because you're not, you haven't, say, had the courage to push or the inclination to push, you find yourself backward, you know, you find yourself stuck. You're not as forward as you would like to be. You know, you're not with the times, quote unquote. So you gotta like push your own pendulum. How you do it exactly, you know, these are metaphors. Okay?
Yeah.
The oil thing on the clock, because I didn't understand what was wrong with the clock, I can't quite say, and sometimes I don't understand the metaphors, but it's up to you, it's not up to me. Okay? But, sorry? Well, it sounds like it was rusty.
A bit creaky.
It's a bit creaky. Well, then that's...
Well, it was almost like, I suppose for myself there's a certain amount of anxiety, so it's almost like I looked at this clock and thought, that's quite beautiful, it just needs a bit of a polish. And then I thought, oh, I better find something that's wrong with the clock, because that's not enough. So there was that sort of process going on. So something about finding something which was wrong.
Did you notice I didn't give you a lot of time?
Yeah.
Yes.
Okay. There's a reason for that. If you give people too much time, the subconscious no longer talks, and we start analyzing. So,
Yeah.
assuming you have a personality that loves to analyze to begin with. So even in your subconscious, you're going to analyze. So it's impossible. It's just part of who you are. So so we're going to assume that you didn't have that much time the analysis was really all in your imagery world as opposed to in love, because you didn't know where it's going. Okay, so my suggestion is that this is kind of, so you're looking at yourself and you're saying, oh, everything, you know, I'm quite well, but there's, you know, I'm quite beautiful, but a little, what was dusty? What did you say about the clock?
A bit rusty.
Rusty. So maybe that is what you actually see in yourself, and then you're saying to yourself, no, but I'm supposed to be better, you know. So maybe that's, you know, there's too much ambition, trying to be a little too perfect or too good. And so maybe that's what's wrong, is that you're over trying. I don't know, you know. So then the lubrication might be more a metaphor for, can I just take it easy? So these are just ideas, you know. I mean, it's up to each one of us I'm just suggesting that whatever is wrong with the clock is wrong with your life. Whatever you did to fix the clock is how you might fix your life. How it gets translated from clock to life is a little bit more, you know, it's more subtle, and it's really up to you, not up to me. I can make up a whole bunch of stories about them, but it really needs to come from you.
So if you put a battery in it, in your clock,
yes, it means that you need a charge.
Right.
It's a little similar to
Yes,
a
I
pendulum,
thought it
but
was
it's a
similar
little
to that.
it's a little bit different. It suggests that you're uncharged. It's not the same as quite momentum, because momentum is the battery will suggest, you know, maybe something like fatigue, you know, something like that, or boredom, or things like that. Whereas the pendulum, you know, there's an element of, there's no momentum in a battery.
Well, it's as though the clock was going, you know, when sometimes the clock goes like that, it doesn't seem to move on.
Yeah.
So,
Yes.
So bang a battery and whoosh, that was it.
Yeah, so where in your life do you feel like you're treading water? I mean, it would be my question. So that's, it's just a cute tool. That's it. Not related to acupuncture practice. So back to acupuncture. So these different conditions that you definitely want to consider with different, you know, anxiety disorders is, because thyroid is definitely, you know, going to, you know, be part of it. I would say that especially with women, you talk about, you know, maybe 30% of all women are going to have a thyroid condition. Okay? And note that in thyroid issues, they may officially not have anything, but because the numbers keep changing every decade, they decided that this is really the correct number. In the next decade, even though it's the same number, they may be considered to not be a correct thyroid condition. Okay, so there's always a possibility. It is in the kidney domain, And I'm sorry that I copied these slides from another PowerPoint, so they came out in the wrong format, so that, you know, it's spilled all over the place. But it's, for me, thyroid is in the kidney domain. And I realize that for TCM that's not the case, but for me, and also clinically, I can show that it's, you know, I treat kidney and it works. Because the kidney channel circles the throat, and also the thyroid is an endocrine gland. Therefore, it should belong in the kidney. Okay? And it will show either on stomach 9 or on the SCM, and it doesn't have to show level of the thyroid, can show below also. So lower SCM can also be thyroid, not just the middle part of the SCM. Okay? And the official dogma is kidney 3, which should be needled, you know, for this, towards the Achilles tendon, is for hypothyroid, and kidney 7 is for hyper. I don't find that this dogma works. Okay, so first of all, because you should, in kidney channel, if the kidney is the main thing for you, check kidney 2. If kidney 2 is painful, you do kidney 7 and 10. If not, you have other options. And kidney 9 supposedly is for goiter here. So, but this is the dogma. My suggestion is to check all the kidney points and see which one does the best job for, number 1, the thyroid, number 2, any other abdominal reflexes you have. Okay? And stomach chi can also be useful. Stomach chi are those bumps between, say, stomach 40 and stomach 41 on the bone though. Okay, so don't take it too lateral. And because stomach 9, it's in the stomach channel. It's on the major point on the stomach channel, so it can disrupt the whole stomach channel. Okay? And then we talked yesterday that if you're having hypothyroidism, you want to activate the DO. So you want to get all the points that are the major changes in the curve. Okay, so that's, you start with DO 1, you might do DO 4, L2, then T11, T12, T7, and T5. I believe that the official Kiiko version is T9 and T4. Okay, I'm saying it as T7 and T5. It's not a big deal. Nobody's going to know which vertebra you're really on. Just look for the biggest curve, and when you know, since I'm looking at Watto's primarily, I don't look so much at the DO. I'm not a DO person. I'm more of a Watto person. When you go on the side of the vertebra and you slide, you feel like little puffy, gummy stuff sticking out from the vertebrae. And don't worry if you're below the vertebrae, at the level of the vertebrae. You know, you're not looking for the intervertebral space, as in according to the book. Okay, you're just looking for the gummy. Okay, that's all that matters. Okay, so, and then in thyroid, consider autoimmune possibilities, and we're going to have autoimmune in a moment, so I'll go through that now. Autoimmune disorders, basically the way we look at it is, it's systemic inflammation. Okay, so in a systemic inflammation, it's a little bit like you had fire point. What do you do when you have fire point pain? You do metal and water. Water to overcome fire, and metal to help water. It's the mother of water by 5 elements. So now you have systemic inflammation, so what you do is you do systemic water would be kidney, right? Systemic metal is lung. So it's kidney and lung points. Which ones, I can't tell you. You're going to have to check according to which ones does the best job. So you see, so you know your strategy. What you don't know is which points, and even if I said kidney 7, how do you know exactly which kidney 7? The one that releases the most in the abdomen, the neck, etc. Okay? So the abdominal findings are serving partially diagnostically and mostly as a checkpoint on you to tell you which point to use. Okay? They're not the pure diagnosis. I don't think it's so good to just palpate, don't ask any questions, palpate and treat. I don't believe that's the best method. I believe it's much better to ask questions and diagnose. Help your diagnosis from the palpation. Okay, don't ignore the palpation. And then confirm your diagnosis by using what you found in the abdomen. Okay? So, yes?
You say in that sense, the reflex is far more useful when you know what point actually releases that reflex. Because the reflex could be different things in different different areas and the point
Yes.
narrows it down.
Okay.
In that sense.
Let me rephrase it. Yes and no, I'm saying that, but I'm also saying actually something else as well. So, you're correct. When a reflex is totally useless if you don't know what it means. So I found pressure pain on gallbladder 57. Okay, it doesn't exist, right? That's the problem. Okay, so because no one knows what it means. Okay, you found some pressure pain. So for you it can be somewhere in the abdomen, but you don't know what it means. And it happens to me, by the way, also. There, oh no, I don't know what that means. Or you find something, you think you know what it means, but it doesn't fit the patient's anything. Okay? Now, so there's a few things that are happening here. Say it's the gallbladder 57 pressure pain, which means there's no book that's going to tell you what pressure pain on gallbladder 57 is. Okay? That's a new finding by you. Okay? Now you have to figure, you may never arrive at a conclusion of what it means because you don't have enough patients with gallbladder 57 pain. And you can say, oh, that means itchy nose. It's like all 10 people with gallbladder 57, the one thing that's in common, they all have itchy nose. Okay, now I understand what next person with itchy nose, I go to gallbladder 57, do you have pain here? And they say yes or no or whatever. Okay, that's one method. The other method is to say, okay, I'm not sure what it is. Well, gallbladder 57 is named blah, blah, blah. I wonder if that could mean, etc., etc. So you start making up stories. And the third method is to say, I have no clue what it means, but here's what I know about this person. Okay? They have thyroid problem, and I know the gallbladder 57 does not represent the thyroid for whatever reason, I already know. Now what I'm doing is, okay, let me try kidney 7 for the thyroid, but I want to see if kidney 7, let's say kidney 7 and kidney 9 both release the thyroid equally well. My gallbladder 57 now serves to choose between kidney 9 and kidney 7 because the thyroid didn't serve well enough to decide between the two. Does that make sense? Okay. So now I'm going kidney 7. Kidney 7 released the thyroid, so did kidney 9. Now I'm checking kidney 7 against gallbladder 57, wherever it is. Okay? And it doesn't release it. But kidney 9 does release it. Now I have a clear reason to choose kidney 9. Okay? Now recognize that what I just said could also work, can backfire against you. What happens that if neither one of them releases, or they both release just as well? Okay? Don't be, so you have to kind of like not be too attached. Okay? So yes, the reflexes serve on the one hand to diagnose, but mostly to confirm the treatment. Because the diagnosis is not complete until you confirm the treatment. Does that make sense? Did that answer the question?
Yes.
All right. So in autoimmune and the other, so we do use kidney points, we use lung points, and which ones they're going to be? They're likely to be kidney 7 or kidney 9, likelihood. Possibly both if you really have to, but I would try not to. And it's likely to be lung 5, possibly lung 8. The original prescription included lung 9 as an option. I don't find, it's rare to find lung 9 to be useful in autoimmune, but it can happen. Okay? But your main point is actually REN4. Okay? REN4 is the small intestine mu point. So you're going to, it's fire, so you're going to yang, to the yang of the yang. Okay, because it's a fire element, and you're going to the small intestine as opposed to the heart. Okay. Now REN4 is also very good for cardiac, by the way. Okay. So, but REN4 you can only do for rapid pulse. So if they have slow pulse, you have to just do the kidney and the lungs. Do mushu instead of REN4. Okay. On the back, you're going to translate all of this to back points. So metal water is going to be kidney shu or outside the kidney shu, and I prefer the outside. Okay? Plus lung shu, UB13, plus outside lung shu, UB42, which gets needled towards the scapula. Okay? So UB52, the outside kidney shu, gets needled towards the spine, but UB42 gets needled towards the scapula. Okay? plus the equivalent of REN4 on the back is UB27. Okay? Now you can say also that the equivalent of REN4 is actually UB26. Why? Because UB26 is named Guan Yuan Shu. Okay, so REN4 is Guan Yuan, and UB26 is Guan Yuan Shu. Okay, versus UB27, which is the small intestine Shu. Its name, small intestine Shu. Okay, either way, they're on the sacroiliac ligaments. There are a few possible places. Autoimmune you diagnose from. They come and they say, I have autoimmune disorder. Okay, there's no body. It's not like you can diagnose this from the body. However, some people, this is a unique aviism, okay, unfortunately you won't get a confirmation on it. Some people will have like redness around here, okay, just under the collarbones, or maybe at the top, around REN22, okay. But in terms of palpation, they'll have sacroiliac ligaments that are kind of puffy and ropey and move around a lot. So they're not ropey and tight, they're ropey and almost like loosened, they're moving in a loose manner. And the other possibility is they're going to have puffiness under the mastoid. Okay, so those are two body findings that you're likely to get with an autoimmune patient. Okay, and that's the treatment. Okay? Then also consider toxicity, because any kind of toxicity, oh, you think you have?
I've got movable sacroiliac joints.
Ah, okay. And what kind of disorders do you have? And what kind of disorders do you have other than that?
Pain in the right iliac.
Pain in the right iliac, that's all?
I seem to be very inflamed, but I've been submitting a research project at the moment. And the last 2 nights I've been to bed at 5:30 and 3:30. So I feel like I'm hypervigilant as well. So
I wonder if you have some sort of
I needed a
rheumatoid
battery for
arthritis.
my clock. So I think that's probably...
You have a battery for it?
I
You
know I
need
needed a battery for the
Oh,
clock, so I
okay.
think that I'm just...
Okay. Can always consider toxicity, because thyroid is very susceptible to toxicity. So anyone who's ever gone through radiation therapy or even chemotherapy, radiation obviously is more clearly related to thyroid. You should check the thyroid. And the treatment for that, the official treatment for that is kidney 9 plus large intestine 15. Liver and thyroid are highly related because of this toxicity metabolic situation. So when you have thyroid, just make sure to, by the way, check the liver in case you forget. Liver is one of those findings that I tend, when I palpate the abdomen, if I were left to my own devices, I may never check the liver. Okay? So it's something that if I check thyroid, I'm reminded to go back to the abdomen and recheck. If I find the thyroid, go and recheck the liver. Okay?
David?
Sorry?
The kidney 9 and Li15,
Uh-huh.
Moxa or needles?
Needles, and you can add, okay, so the whole subject of Moxa is this. Large intestine 15 is a Moxa point. We have a bunch of Moxa points. So I prefer to also do Moxa on large intestine 15, but I'll tell you the honest truth. You can just use Moxa in your clinic and never use needles. It's possible. It will take you forever to treat people, though. Okay? You can also just use needles and never use Moxa. And it's totally fine, and it works. I believe, my personal belief is that, now I do not do Kyotoshin at all. I don't do Moxa on top of, big Moxa on top of a needle. Stinks, can't handle it. I only do direct Moxa, OQ, on the skin. But you can do it right next to the needle. And it is a very good thing to add, especially for people with all sorts of immune issues, inflammatory conditions, even though it's heat. I know the TCM people like immediately go, how can you do Moxa on a heat condition? Totally you can do it. Because for me, Moxa is not about heating, Moxa is about dissolving connective tissue. So anybody with lung issues, immune issues, who's very deficient, adding Moxa to the points is very helpful. But if you just use needle, some people, have work situations where doing Moxa is just not an option. They just don't have time between patients or whatever. Then fine, just needles works. I had a clinic partner, and we would go and do, do health fairs or whatever, and we would treat lots of people, like 10-minute treatments or whatever. And he would go, why do you do all this Moxa at night? There's no reason. All these people get better without it. So yes, it's true, but the treatments last better when you add Moxa, treatments last better. So I think the Moxa is not essential in some manner, especially if you want to tell them come back this week still. If you want to extract more treatments from them, definitely don't use Moxa. But if you don't want them to come back this week, you actually want the treatment to last as long as possible so that they can actually come back next week, you're better off adding Moxa.
And on that combination, if you're going to add Moxa,
Large intestine 15 is the Moxa
not
point.
kidney nine.
Kidney 9 is not all that, you could, but you'd have to have a good reason for kidney 9 to add Moxa for kidney 9. The large intestine 15 you could do automatically. The kidney 9 is like, okay, there's I've never seen puffy on kidney, edema on kidney 9, but if you have a reason that you really want to do Moxa on kidney 9, I'm not going to object. But this one is like almost automatic for Moxa.
Which are the kind of Moxa points, just your favourite ones in a nutshell?
In a nutshell, okay. So liver 5 is definitely a Moxa point. It's not a needle point. It's the one that I can say definitely not a needle point. The center of the heel, you saw that yesterday, is a Moxa point. Liver 5 I use for endometriosis primarily. And it's anti-inflammatory for the lower jiao. Spleen 5 I would tend to do Moxa on, if I can. It's another if I'm using it as an anti-inflammatory for the lower jiao. So the guy yesterday that we did spleen 5 on, that was for the knee, stomach 41, so spleen 5 for the knee. That doesn't require the extra Moxa. Immune point, I love to add Moxa on. Okay. Large intestine 15, I love to add Moxa on. Liver 1, which we did do yesterday on someone, I believe. Yeah. I didn't do Moxa on her, but generally speaking, it is considered a Moxa point. And why? Because anytime you have element on element, liver 1 is wood on wood, we tend to start thinking Moxa. Okay, so that means here are the big ones on that. Kidney 3. It's kidney 3. Sorry, spleen 3. Kidney 10 is not a Moxa point. It's water on water. This is a contradiction of what I just said, right? Okay, so be aware. Just gave you a rule, and it's not going to work 100%. But lung 8, often we like Moxa. Spleen 3, we like Moxa. UB66, that's water on water, just like kidney 10 is water on water. I like Moxa on that. Largeness 14, I also anything on the deltoid, I like Moxa. I love Moxa on the upper back. The rhomboids, inner border of the scapula, small intestine 11, those are like Moxa suckers. I mean, seriously, this is, and this is where you'll see, and when you're treating both cardiac and lung, okay, you're treating around the chest. You're sort of solving the reflexes on the chest, say small intestine 11 in the case on the left, in the case of cardiac, rhomboids in the case of the lungs or the kidney line or whatever. At the end, on the back, you actually want to Moxa the reflexes that you used. For both cardiac and for lungs, this is a unique situation. You're not going to see that. We don't do Moxa on liver. We don't do Moxa on spleen or stomach or, those are places where, no, okay. So at the end of cardiac, I will do a cardiac treatment. After I've done everything, then I can go and stimulate the heart directly. You cannot stimulate the heart until everything else is resolved, because what happens if they have edema or they have low blood pressure? You're pumping against either a vacuum or against too much pressure. Okay? So I can't stimulate until I move the water, or until I resolved everything, then I can go and do Moxa on small intestine 11. With the lungs, it's a little different. You can actually do the Moxa if you want to, without any other treatment if you really want it. But, so with lungs, you do the lung 5, you do, say, spleen 4, for example, we saw yesterday, or the kidney 3 for asthma. And then on the back, you resolve the rhomboid as much as you can. Like you saw, for example, the trochanter point to resolve rhomboids. Then at the end, when they're on the back and you've done everything, then at the end you needle, say, UB13, UB42, something like that, that's directly on the lung area, and add Moxa to it.
So I've got some restrictions about whether I can use Moxa. Do you think that a heat lamp could achieve some
Okay,
level of...
hold, okay. Your restriction is because of where you're working in terms of, okay. Chances are direct Moxa is not going to bother anybody. They're not even going to know that you used it.
Right.
You know, so I would just, you know, if my personality would be, I know you're not supposed to have Moxa according to my lease, but nobody's going to know, and I'll do whatever the fuck I want. Okay, that's my personality. Okay, I would not do big Moxa because I know I'll get found out. Okay, so hey, you know, it's like you got to play a game that you can win. Okay, so the chances are you can win a direct Moxa game. You could win. Okay, but you're not me, so you know. So a heat lamp, or this is what I use, is the equivalent of not Oku but Kyotoshin, which is like having a needle and then putting big Moxa on the needle. Those are two different modalities. The Kyotoshin is meant for, the skin might be warm, but when you press it, the Kyotoshin we use primarily on the abdomen or the buttocks. Well, actually it's not we because I don't do it anymore. I refuse. But, so what I do instead, so when you press, it doesn't matter if the skin is warm, what matters is when you press you find that it's cold. It can be like a refrigerator inside. So that tends to be in the abdomen, GB26, sacroiliac, maybe, you know, GB30 area, those kind of areas where there's a fair amount of flesh. Those can have that freezing cold inside. That's when you put a metal handled needle and put Kyotoshin in. Since you're not going to do that, I don't do that either, what I do is I take a sock, no holes in the sock please, and I put corn, agricultural feed corn, but you can put rice in it, put it in the microwave for 5 minutes, and actually before the patient comes, I put I always have one of these packs in the winter inside the blanket. At the end of the treatment I cover them, okay? So the blanket is warm, they like that. It's very nice to have a warm blanket. But then I take that pack, instead of just putting it on their abdomen, I'll put it right next to the needle, you know, of the cold area. So that's my equivalent of Kyotoshin. Does that make sense?
I'm just trying to...
Heat lamp generally is not quite, it doesn't penetrate quite as much. But something, a grain, do you remember when, well, maybe you don't remember, maybe you didn't do it. When we were kids, we would sit on the pavement, okay, waiting for the bus or something, right? And it's earth, right?
Yeah.
So in the winter, you're sitting on the pavement and your butt is freezing cold, even if outside it's not that cold, because earth and stuff transmits heat or cold, you know, has that property of transmitting much more than other things. Okay, so that's why grains, you know, like corn or rice will have that quality of pushing the heat into the body. Yes?
I'm saying there is the Banshin for people that want, I know not many people use them, but you know, Kiiko uses one.
This is the smoke.
This is the Oku equivalent, electric Oku.
Oh, electric Oku.
Yeah,
oh.
you have a little battery in it, and it heats the tip to 60 degrees just for, and it feels just, you get an insect bite of heat, so it's the nearest thing to Oku, and it's really quick, and it's no mess, and it doesn't stick to your fingers.
Yeah.
It doesn't set the alarm.
Right.
And Chico could tell you how to get them. I mean, from the website you can only get them from the van, but
and hopefully they sell to you.
or a friendly Japanese person who will bring them over for you from the.
So that's.
There, so you just look up Banshin. I mean, I only saw it because Kiiko described how she always takes one on the plane because she does. She says, I can't bite up Oku on the plane if I feel, but I take my Banshin and then she can treat herself on the plane.
It's like, you know, on the plane I just go to sleep. Even if I need a treatment, I'll go to sleep. I don't care. But some people are, we are dying to treat all the time, so we have to treat even on the plane.
They used to make them. They had two grades, like soft and hard. And the soft was like some people can't take the hard
it's
one.
too much.
It's too hot. But the latest model, you can set it for hot. So
okay, well,
and it lights
the
up
whole Moxa
prettily
thing
with
is basically that's it. You don't have to do Moxa ever again.
They're expensive, but the battery, you put one battery in, it lasts for 6 months. You know, so it does not.
How much is very expensive?
I don't know the latest price, but something like maybe £300 or something. But
I'll do that.
Okay, well, you know, for £300 you get 6 months worth of
Do
Moxa.
you
For one month.
use electric? Do you use
Electric steel? No, I use something called the Pachi, but no
Oh,
electro.
yeah.
But no, I don't do electro. All right, let's get Margaret
Can I
in.
just ask about,
Yes,
sorry,
Margaret, go on in. Yeah.
stomach channel?
Stomach channel.
With thread Moxa.
Yes, stomach chi it would be another place that Moxa would be very useful. Yeah, that I would tend to add Moxa.